we got?
22-year-old female, 90% burns, multiple third-degree burns. Got 2 IV lines started.
The Brooke Army Medical Center in San Antonio, Texas, receives hundreds of burn cases every year. Many have multiple injuries, and nearly all require intubation so the patient can breathe.
When a patient sustains burns to their face or any other part of their body, that area may become rapidly and markedly swollen such that the amount of space that's used for normal passage of air is decreased, and the patient is at risk of losing their airway.
To prevent that, the endotracheal tube has to be secured in place with tape and a bite block. For burn patients with fragile, swollen, and damaged tissue, that presents other risks.
And you can see at the corners of the mouth here where the tie could easily cause injury.
Cuts from the tape lead to permanent scarring of the patient. Basic oral hygiene and other oral procedures are difficult to perform. To find a solution to these problems, Dr. Renz turned to respiratory therapists Gabriel Wright and Brendan Bealey.
I got on the phone and contacted 3 or 4 burn centers, and they pretty much have the same kind of issue.
We're a couple smart guys, and just because there's no ready solution out there doesn't mean it has to be that way.
With no budget to work with, off-the-shelf supplies, and their own ingenuity, they began designing a better bite block.
This is a commercial bite block that's available off the shelf, and we took pieces of this one. This is a standard intubating stylet that was flexible enough that we could mold it into the shapes we wanted, and we just bent it around and came up with the configuration we wanted. Once we were happy with it, we glued it all together with some silicone adhesive and gave it back to Dr. Renz and said, hey, this is what we're thinking, this is what we've came up with, what do you think?
I think it's just a huge step in the right direction to make something better.
Wright and Bealey's bite block enhanced the security of the endotracheal tube, at the same time reducing the risk of patient skin damage.
Went from 1 bite block to 2 bite blocks and moved them to the back of the mouth to utilize the molars, the strength of the back of the jaw. And we angled our framework here to bend in such a way that we completely avoid the corners of the mouth. What we use now, the points of attachment are coming right across the soft tissue here. With this, your points of attachment will be slightly forward so that as the ties come back, instead of coming across here, they'll be coming back further back on the face.
Institute of Surgical Research is designed to be an organization that makes things better for combat casualties. Now in this particular case, this particular project, the potential benefits are enormous.
Hi, I'm Sarah Miller with the U.S. Army Medical Research and Material Command. As you've seen, the bite block is particularly helpful with burn or trauma patients. However, it can be used on any patient requiring intubation. The U.S. Army is currently looking for U.S. and international partners for the further development and commercialization of this technology.